So today I'm going to be demonstrating how to do a central line dressing change on my patient. So I'm going to go ahead and introduce myself and let him know what we're going to be doing. I'm going to wash my hands. I've got my sanitizer right here and provide for privacy. And knock on the door. Knock, knock, knock. Hi, my name is Heather. Your doctor has ordered a central line dressing change for you today. It's been about 7 days since your last one. So we're gonna go ahead and change that for you. Could you tell me your name and date of birth, please? My name is John Smith. I was born in September 7th, 1981. Okay, great, Mr. Smith. Can you tell me if you have any sort of allergies to iodine or any sort of skin allergies I should be aware of? No, I don't. Okay, so he doesn't have any allergies, so we're gonna go ahead and proceed. I would put a mask on Mr. Smith, but we don't have any masks because unfortunately I used them all up in the prior demo. So we're gonna do a little improvising here. I would ask Mr. Smith to just turn his head to the right, ideally if we didn't have a mask, or we can pretend that he does have a mask on. If there were anyone else in the room, I would have them wear a mask as well, or have them leave the room. Okay, so now that that's done, I'm gonna go ahead and wash my hands again. Before we take off this dressing and change it. I'm also gonna make sure, obviously, the PICC line goes below the heart. So we're gonna come over here, and I'm gonna open up my central line dressing change box. Again, we've had to improvise a little bit. As you can see, there's a paper towel. Normally it would come in plastic, but doing my best here to improvise. So this, I'm gonna go ahead and open this. I would open it away from me. It's a little bit tricky here. And let's see what we have in here. Okay. Normally I would have a mask in here. I would also have a couple things that I'm missing. One would be the alcohol swabs. Instead, I'm going to be using a Q-tip. Normally I'd have about 3 of them ideally, but we're going to be using 1 for the sake of this demo. I'm going to go ahead and remove my gloves, which are sticking to my dressing, which I had to improvise, so it's a paper towel. So I know I should not be touching this, but I'm going to have to touch it anyways and get my gloves out. I would have a mask in there. Again, wash my hands. I would put on that mask. Unfortunately, my Q-tip fell off, which it wouldn't supposed to. That's a boo-boo, which shouldn't happen. That being said, I know I'm breaking sterile field. I know I don't have my gloves on. I know I'm reaching over, but I'm going to put that back in here. But I'm aware that I went over my sterile field and that that was contaminated, just so you know that I know. Okay, so now I have my mask on. I'm going to wash my hands. I'm going to put on my clean gloves. And I'm going to show you how I would remove the dressing change. As you can see, we have a paper towel on Mr. Smith. Normally that would be a transparent dressing with adhesive on the back, but I don't have that. Those were thrown out after the demo that I submitted prior. So the way you take off a dressing, you would loosen the edges, and then you would pull in and bunch it up. You could stabilize the catheter. So I'm going to do my best here to show you. Loosening those edges. So we're loosening, and bunch it up in the middle, and throw it away. Got my trash can here. I would look at this and I would ask Mr. Smith if he's had any sort of pain, any sort of irritation. I would assess the site for any sort of redness, any sort of swelling, any sort of oozing, any sort of odor, anything that could indicate an infection. So I'm now going to go ahead and take off my gloves. I'm going to wash my hands again and come back over, being aware of my sterile field. I know we have the 1-inch border, not to put your waist over or anything, have it at waist level. And we are going to open my gloves. And I've had to improvise here a little bit as well. These are not the normal gloves, but here we go. A little bit tricky here. Okay. So now what I'm going to do that I have, now that I have my sterile gloves on, is I still have my chlorhexidine left. I'm going to take that and I'm going to use that to clean Mr. Smith's site. So I'm going to pick that up. No, you don't want to turn your back on your sterile field. Gonna grab this. I know that this is now my contaminated hand. I am going to take my chlorhexidine. I'm going to clean from the least contaminated area to the most contaminated area, excuse me, in a circular motion, using a lot of friction, about 2-3 inches down. Keep scrubbing, lots of friction, and I would throw this out. So there's my trash can there. I know that that's still my contaminated hand. I am then going to grab, without reaching over my sterile field, it's very tricky, my cotton swab. Again, ideally I'd like to have about 3 of these, but I don't, so here we go. And it would have alcohol in it. So I'm going to clean down about 3 inches, down the sides, around, and I would, again, like about 3 inches down. Drop that in the trash, and I'm gonna let that dry. Once that's dry, I am going to put on the adhesive. Again, we're using a paper towel, so aware that this hand is contaminated. I'm gonna come over back to my sterile field, not reaching over. This might be a little bit tricky because I did pre-tape it, but again, we don't have the adhesive that we had last week. So I'm gonna pick this up. I would take off the backing, being aware that my left hand is my contaminated hand, so I would be very careful about how I would put that on him. With the adhesive backing, would be safe for me to touch about there. So I would place this right over the insertion site. So let's see if we can do that. I don't have tape there, but for the sake of this demo, I'm going to pretend that there is adhesive on the back, so it would be sticking. So yeah, with the paper towel. Let's just assume that that's going to be sticking, and unfortunately it's a little bit tricky with that paper towel. So I would take off my gloves, put them in the trash can, wash my hands. I would have a piece of tape that I would have tore off too, where I would place my initials. I would put my my initials, the date, and then I would go ahead and document. And what I would document is that I just did a central line sterile procedure, change of dressing. I would obviously have the date, my name. I would document that Mr. Smith tolerated the procedure very well, that there were no signs of infection, there was no oozing, there was no redness, no inflammation, nothing that indicated any sort of infection. I would also mention to Mr. Smith again that we would change that dressing in about 7 days. So after that, I would just check on Mr. Smith. I would come back, make sure that he's comfortable, his position is comfortable, ask if he needs anything, provide privacy, wash my hands again, and that would be it.